Body fluids. P wave, depolarized atria. QRS complex, depolarized ventricles. T waves, repolarized ventricles. repolarization of atria नहीं होता है, याद रखिएगा. Arteries, thick wall and narrow lumen as compared to veins. Injection veins में लगाते हैं. RBC 20 to 25% CO2. Tricuspid heart, partially non-functional. Blood in pulmonary artery reduce. Tricuspid heart palpitation, partially non-functional. Blood in pulmonary artery reduce. Bundle of his heart, 190 to 110 mmHg, harm vital organs like heart, brain, kidney. PNR, diastolic and systolic blood pressure. Myocardial infarction, streptokinase. AB in antigen, no antibody in plasma. Parasympathetic neural signals, reduce both the heart rate and cardiac output. BP aorta in maximum during systolic of left ventricles. Erythropoiesis starts in red bone marrow. Deficiencies antibody. To look at serum globulin. Second heart sound, semilunar valve close down of blood flow into vessels flow. From ventricles. Second heart sound, semilunar valves close down after blood flows into vessels from ventricles. Largest amount of urea, hepatic veins. BP in pulmonary artery is more than that of pulmonary vein. RBC inequated all space for O2. Hepatic portal vein liver to intestine. Tricuspid valve between right atrium and right ventricular. Bicuspid valve left auricle and left ventricle. Semilunar valve right ventricle and pulmonary artery. Reduced T waves, coronary is ischemia. SA node normal pacemaker has high rate of depolarization. Eosinophils, histamines. Basophils, granules containing histones. Neutrophils, phagocytosis. Lymphocytes, immune response. Fibrinogen, enzymes convert into fibrins. Thrombokinase. Thread, fibrins. Erythrocytes, platelets, neutrophils, monocyte, eosinophiles. तो eosinophiles 1 to 3%, monocytes 6 to 8%, neutrophils 60 to 65%. Abundance है ना. T wave, end of systole. Heart rate, cardiac output, stroke volume 5000 by 50. ये क्वेश्चन का डाटा था. Excretory system, हाँ. Urinary bladder, stretch receptors totally removed. No micturition. 99% glomerular filtrations reabsorbed by Renal tube. Drinks lots of water. ADH suppress. Not a part of renal pyramid. Convoluted tubules. Fall GFR activates juxtaglomerular cells of reductase renin. Adrenal gland corticolamines stimulates glycogen breakdown. Na plus reabsorption in DCT increases aldosterone level. Not favor formation of a large quantity diluted urine. Renin. PCT removal. More diluted urine. Human urine acidic. H plus actively secreted into filtrate. Ascending loop impermeable to water. Descending decrease in blood pressure volume will not cause release of atrial neuritic factor. Glomerular nephritis, inflation in glomeruli. Concentrated urine. Concentration of urine is Helen's loop. Dilution of filtrate takes place due to efflux of electrolyte in medullary pyramid. From hypothalamus, ADS release diluted urine. Contraction of uterine hyperosmolarity inner interstitial medulla. Contraction of urine hyperosmolarity inner interstitial medullary. Artificial kidney, low calcium ion absorption, reduce RBC production. Descending limbs of Helen's loop, reabsorption of O2 only. Descending limb of Helen's loop, reabsorption of water only. Ascending limbs, reabsorption of salts only. DCT, conditional reabsorption of Na plus and H2O. Prevention of diuresis. ADH reabsorption of Na plus and H2O from renal tubules due to aldosterone. Prevention of diuresis. ADH reabsorption of sodium and water from renal tubules due to aldosterone. Prevention of diuresis due to aldosterone. Osmolarity. Concentration. Use Helen's loop and Vasarecta. ANF. Check on renin, angiotensinogen. Locomotion. Iris. Smooth involuntary muscle. Elbow joints. Hinge joints. Ilium. Ischium pubis. Coxal bones of pelvic girdles. Decreases calcium body fluid. Tetany. Human skeleton. Parietal plus temporal bone joints by fibrous joints. Sternum of and ribs. Axial skeleton. Humerus and ulna. Humerus and ulna are appendicular structure. Appendicular skeleton. Medulla and stapes. Ear ossicles. Clavicle and glenoid cavity. Cavity between scapula and clavicle, pectoral shoulder girdle. Clavicle and glenoid cavity. Cavity between scapula and clavicle, pectoral shoulder girdle. Thigh. Straight and voluntary. Joints uric acid crystals causes inflammation. Fluid filled synovial cavity between two bones. Joints between atlas axis, atlas H zone, central gap between actin filament through myosin filament in A band. Glenoid cavity articles, humerus with specula, no movement, fibrous joint. Lack of release in muscular contraction, tetanus. Poivite, atlas, axis. Synovial joints. 7 pairs of vertebrosternal. 3 pairs vertebrocondyle. 2 pairs of vertebral ribs. Acromion clavicle. Scapula, 2nd and 7th ribs. Glenoid cavity, head of humerus. Z lines of plus actins, pull inwards. I band, reduce width. Myosin hydrolysis ATP, release ATP and PI. Palm bones, metacarpals. Wrist bones, carpals. Ankle bones, tarsals. Digit bones, phalanges. Straight appearance and skeletal muscle, actin and myosin patterns. Adjacent bones of vertebral cartilage. Intercalated disc is ID. Band A length not change. Scapula, triangular flat bone. Cranium, fibrous joint. Sternum, flat bone. Vertebral column, cartilaginous joints. Smooth muscle, involuntary striates, wall of blood vessels. Neural system. Resting state, more K plus permeable and nearly impermeable to Na plus. Snake, sympathetic paranervous systems, epinephrine and norepinephrine from adrenal medulla. No role in hearing, vestibular apparatus. Hindbrain pons, medulla oblongata, cerebellum. Retina, photoreceptor, rods and cones. Abundant intercellular cations. Abundant intercellular cations is K plus. Rhodopsin, purple. Anterior horn cells, spinal cord, loss of voluntary motor impulse. Fovea, high density of cones, no rods. Corpus callosum, communication between left and right cerebral cortex. Cerebrum, calculation and comprehension. Medulla oblongata, homeostatic control. Photosensitive, opsin and retinal. Receptor do not produce graded potentials. Receptor sites for neurotransmitter, postsynaptic membrane. Myelin sheath, Schwann cell and oligodendroids. Renal absorbs visual photopigments. Myelin sheath, Schwann cells and oligodendroids. Renal absorbs visual photopigment. Transport in human eye. Ligaments attached to ciliary body. Transparent lens in human eye is attached to ciliary body. Nissal's bodies are mainly composed of free ribosomes and RER. Corpus callosum, left and right, connects. Eustachian tube connects middle ear and pharynx. Cones are densely packed. Fovea. Photoreceptor cells, rods. Visible color portion of eye, iris. Iris is visible color portion of eyes. Brainstem, midbrain, pons, medulla oblongata. Chemical coordination. Myxoderma decreases metabolic rate, increases body weight, retain water in tissues. Adrenal cortex, aldosterone, androstenedione, cholesterol. Somatotropin, delta cells source. Corpus luteum, relaxed serotonin. Insulin, diabetes mellitus. Glucagon, hormone regulate blood sugar level. Norepinephrine, adrenal medulla, increases heartbeat, rate of respiration and alertness. FSH, ovarian cell membrane. Post pituitary, vasopressin stimuli reabsorption of H2O in distal tubules and nephrons. Oxytocin, pituitary, not sugar metabolism, aldosterone. Master gland, structural and synthesis elsewhere. Melanocytes, stimulating hormone. Tryptophan, amino acid tryptophan, melatonin and serotonin. Relaxin, inhibin. Not tissue, endorphin gland stores and release hormone. Graves' disease is caused by due to hypersecretion of thyroid gland. Peptide hormone, hepatocytes, insulin. Temporally endocrine gland, corpus luteum. Amino acid derived hormone, epinephrine. Gastric indirectly helps in erythropoiesis, parietal cells. Steroidal hormone influences cellular activities, binding DNA and gene hormone complex. Insulin, diabetes mellitus. Thyroxine, goiter. Corticoids, Addison disease. Growth hormone, acromegaly. Parathyroids, decreases blood calcium level. Pituitary gland, diabetes insipidus. Thyroid gland, Graves' disease. Adrenal gland, Addison disease. Pancreas, diabetes mellitus. Neurohypophysis, oxytocin and vasopressin. Pituitary hormone, peptide and protease. Epinephrine, biogenic amines. Endorphins, neuropeptide. Cortisols, steroids. Relaxin, corpus luteum. Erythropoietin, juxtaglomerular cells of kidney. Multineuron, cerebral cortex. Bipolar neuron, retina of eye. Unmyelinated, spinal nerves. CCK, pancreas. GIP, gastric gland. ANF, heart. ADH, kidney. FSH, stimulates spermatogenesis. Thyrocalcitonin, carbohydrate metabolism.